Hey, good morning, everybody. Welcome to Public Benefits for Older Adults. Thank you all for joining us. I'm Carolyn Osuyos with ElderWorks, and I just want to remind you that this event is being recorded. We are live on Facebook, and this video will be posted on your YouTube channel. ElderWorks Educational Services is a not-for-profit 501c3 corporation whose mission is to provide older adults, seniors, and their families with information, referrals, and guidance for senior living, home care, and support services. The guidance we provide will help seniors stay at home or transition well into a new senior housing opportunity. We also provide, as you see from this event, virtual education for not only our community members, but also for professionals. And I wanted to tell you about some new educational opportunities we have coming up. So very soon we are going to have a Ask a Nurse series starting 1 week from today. This will take place the second Thursday of each month at 10 a.m. This month's topic is gearing up for the flu season. Chris Petrick, our nurse training specialist, will discuss the importance of vaccines, current progress on COVID-19 vaccine, and what to expect this flu season. If you attend, you will have a chance to ask questions about the flu season. We have a caregiver symposium coming up on November 17th. There will be 6 classes offered on a variety of topics centering around caring for a loved one. If you're interested in finding more about our caregiver symposium, please let me know in the chat and we'll email you the link to the classes being offered. This event is free and you can attend the classes that interest you anytime you like. If you have any questions throughout the presentation, please use the Q&A or the chat button on your screen to ask questions. And please note that you will be muted during the presentation. After this webinar, a short survey will pop up on your screen, and we would really appreciate your feedback. So with that, we are happy to have Joy Aaronson with us today. She is the Benefits Access and Information Specialist at AgeOptions, and I'll go ahead and turn it over to her now. Thank you, Joy.
Oh, thank you, Carolyn. It is really great to be here today, and I want to thank you, ElderWorks, for inviting me and hosting, and thanks to each person who is attending. So again, my name is Joy Aaronson, and I work for AgeOptions. So we're going to talk about some of the programs for older adults, and then if I'm talking too fast, please put something in the chat box or Q&A so that Carolyn can let me know that I need to slow down. Okay, so welcome. Our topic is public benefits for older adults. What are they and are you eligible? And we're gonna keep going. So as I said, I work for AgeOptions. I don't know how many of the people in this room, the Zoom room, right? Or the Facebook rooms are familiar with our agency, but we are also a 501c3 nonprofit. We were incorporated in 1974, and just a quick warning in this presentation and in the world of aging, there are a lot of alphabet soup and acronyms and abbreviations, right? And so by IDOA, and you might ask what's IDOA, that's the Illinois Department on Aging. And they designated us as the Suburban Cook County Area Agency on Aging. So our service area is Suburban Cook County, and that's not the city of Chicago. And it's made up of 30 townships, 130 different communities, and we serve approximately 573,000 older adults. That is over 500,000 people. Our sources of funding come from state, federal, corporate, private foundations, and individual donations. The mission statement of AgeOptions is we innovate, partner, and advocate to improve systems and services in order to strengthen communities so people thrive as they age, which is what we all want to do, right? Okay, I'm going to move this down. So I'm going to talk just very briefly about AgeOptions' role as a AAA. Now, most of you might be more familiar with AAA as the American Automobile Association, of which I am a member. But this is different. Again, it's the Area Agency on Aging. So as of the AAA for suburban Cook County, we serve individuals with disabilities and those 60 plus. And we also fund local agencies to provide services directly to community members. And we can talk about that a little bit at the end. So because it's such a vast area, there's different organizations that cover different geographical areas. And I can let you know which ones you call us or let you know which ones you would fall under. And the services include in-home care, adult day services, congregate. Congregate is group. And so congregate meals, usually lunch, and that was pre-COVID, right? Remember back in March, and as things open up post-COVID or at a different stage. Home delivered meals, caregiver support, and that's caregiver as an unpaid caregiver, whether it's a family member, neighbor, loved one, elder abuse, Medicare education, and much more. So in FY, which is fiscal year 2019, AgeOptions and our funded partners served 172,077 individuals. Okay, so, all right, AgeOptions supports services and programs that make it possible for older adults to live independently in their homes and communities. So here's a little disclaimer. So when we're talking about public benefits, the eligibility criteria changes periodically. So information in this presentation is accurate as of September 2020. And AgeOptions is not responsible for the determination of eligibility or the amount of benefits granted. And always consult with the current eligibility guidelines at the time of the application. Okay, so I'll talk about, so basically our goal, right, the goal of the benefits access is to increase the financial stability of older adults and persons with disabilities through enrollment in, and I'm going to talk about some of the different programs. So the first one is called Medicare Savings Program. Of course, it has an acronym, right? MSP. And it's a Medicare Savings Program that pays for Medicare Part A and Part B premiums. So we could spend hours and hours on Medicare. There's many different nuances, and I'm not the expert on Medicare, but just as a framework, Part A is the hospitalization, and people who have worked 40 quarters, 10 years in their lifetime have already paid into that. So there's no cost for that. But Part B is the outpatient, doctors, lab tests, diagnostics, etc. And if somebody is receiving Social Security, then what happens is that amount, which is approximately $144.60, is taken out of their Social Security check. If they're still working or they're not getting Social Security, then the person would pay directly to Medicare. Okay, so this program, the MSP, also covers deductibles and co-insurance. You can see at the bottom the red, white, and blue card. So it's really for very low income individuals. I'm not didn't do a slide with all the numbers, but the amount, because there's several different tiers, right, range from a monthly income of $1,088 to $1,461 for an individual. And the assets are less than $9,300. $60 for an individual. Okay, so that's the story with the Medicare Savings Program. This is just an overview, so just wanted you to get that piece, to know that that is one of the benefits that we are most happy to help people apply for. Another benefit is called Extra Help Low Income Subsidy. Okay, or LIS, right? So just to make things even more confusing, sometimes people call us and say, I need some extra help. Well, extra help could be general, you know, I need extra help with food, with rent, with housing, etc. But this specific capital E for extra, capital H for help is for the drug program. So it works with the coordinating Medicare Part D plans. And I always remember Part D, D stands for drugs. So it's no or low premium or co-payments for the drugs. And for this particular program, the low income subsidy, extra help, that's a program that the Social Security Administration processes the applicants and makes the decisions. Okay, so now we'll go on. So now we're moving away from Medicare and on to food. And I mean, if we were all together in one physical room, I could ask you if you've heard about SNAP or the link card, and I could ask you many questions. You could raise your hand, etc., or not. But I'm just so glad we're doing this so people can hear and participate. So this is the Supplemental Nutrition Assistance Program, short for SNAP, but not that kind of SNAP. And it helps people buy groceries. And there's the SNAP program for all ages. Since we focus on older adults and people with disabilities, we know the guidelines for those age groups or folks with disabilities. So we focus on people who are 60 or older, blind, or disabled. Disabled being that they are deemed by the Social Security disability insurance to have a disability. Okay, so the monthly gross income standards are less than $2,082 for an individual and less than $2,818 for a household of two. Okay, so that's a higher income, monthly income than what we talked about for the Medicare Savings Program. And just to clarify, that household of two could be a married couple or could be people who live together and eat together. Okay, in this particular program, the assets do not matter. And they do take monthly expenses into consideration. Now, monthly expenses in this realm is not credit card debt and it's not a car note. So monthly expenses are your housing costs and anything related to that. So you either pay rent or you have a mortgage, and then there's homeowners insurance, there's property taxes if you live in a condo, you would have your assessment fees. There's also, people might have high medical bills. They might have paying premiums like Medicare supplements, etc. That they'll look into, and there's a whole formula that the state has, so that if you earn, if you're getting a little extra than that amount, then it's possible you might be eligible. And the amount you'll get, and just so you know, again, it's SNAP, it's a link card, also called food stamps, for an individual is between $16 and $194 a month. And during the recent pandemic, people have been getting the maximum. Okay, so I love apples. I love apple pie. And so this is just an image for you all. So SNAP is not apple pie or cherry pie or pizza pie. So when you have a pie, hopefully you cut it fairly evenly, right? And you distribute the pieces. And when the pieces are gone, then the pie is gone. Well, SNAP is not like that. I've done a number of presentations to older adults, and many of them tell me, because we're in the room together, you know what, it's okay, because I've been scrimping, I've been saving, I know how to get by. And I think that this should go to families with young children. They're growing, they need their milk, they need their protein, etc. And I get to say to them, which I love to do, to say, you know what? It's not either or. If you're eligible, the money is allocated. You pay taxes, your family members, your neighbors, etc. have paid taxes. And this is one of the benefits. This is something that comes from your taxes. I also want to just share a message that they've done research. The economists have done research, and they have found that for each dollar in SNAP benefits in a downturn, and we are in a downturn, right? It generates between $1.50 and $1.80 in the economic activity. So it's helping the economy. Okay, good. So I also want to talk about stigma. So I am old enough to remember when SNAP was in food books. There were physical little booklets that had tear out coupons with different colors for different denominations of money. And I can remember to this day being in the grocery store. The gentlewoman was behind me and somebody was in front of me. So I'm between two gentlemen. The person in front of me was paying for his purchases with food stamps. And the guy behind me was screaming. He was absolutely livid. And to this day, I can still remember him saying, "That's just not fair. He shouldn't be getting that. That guy up there, he's getting food stamps and he's getting steak and I can only afford hamburger. That's wrong." And everybody around is looking, and the person paying for the purchases with the food stamps was absolutely mortified, as any of us would be. So I am so happy that those days are gone. Now the benefits are on a link card, and it's a blue card, and it's a debit card. It's like a debit card, but you can't use it to buy other things other than food. And it's loaded, the amount is loaded into the card, certain time of the month, and you can carry over the amount to the next month, you know. So anyway, that is SNAP. Now let's talk for a couple minutes about transportation. So there's something called the Benefits Access Application, or in my world with the abbreviations, BAA. And it is for seniors ride free, so somebody would not have to pay for public transportation, and a license plate discount. You can get both. And the qualifications are the person must be 65 or older, or an individual with a disability and live in the state of Illinois, because Illinois does not want to pay for any benefits for people that live in neighboring states like Indiana, Wisconsin, Michigan, etc. Understandably so. Okay, the income limit is higher than the previous benefit programs that I talked about. So for this program, the limit is $33,562 a year for an individual, $44,533 a year for a couple. Okay, and we can help people, or you can apply yourselves online at the Illinois Department on Aging, IDOA website, which is down there. So I'm just going to say a couple words about the license plate discount. In general, for the general population, the cost for the sticker is $151. This discount is for $127. So somebody who's eligible for this would only have to pay $24, and it lasts for 2 years. So I also want to just talk very briefly, computers talk to computers. So I'm just going to tell you a tiny little story. So I got to do a lot of in-person presentations before COVID, before March, and was doing one at a senior apartment, a low-income senior apartment, and did the presentation, and then our team would come back and help people with enrollment. They would bring their documents and we'd bring our laptops, etc., and sit in different parts of the room and get all the information to help people apply. So I was so excited. I went back to the office just walking on air, and I was telling my colleagues, I am so excited. There's a gentleman and he doesn't have any income. He has almost nothing in Social Security. I think he's going to be eligible for MSP. He'll definitely be eligible for SNAP. Oh, and he's going to be eligible for the license plate discount. So I started with the license plate discount, applied on his behalf, and it came back rejected. I was like, oh, this doesn't make sense. So I called, and without them giving me too much information, they said, he's over income, he's working. Our computer talks to the Illinois Department of Employment Security's computer, and he's working. So I called him just to let him know and clarify, and he said, it's none of the state of Illinois' business what I do and what I work. And I said, in this case it is their business, because they want to make sure that people are eligible, and because you're working, unfortunately, you're not eligible. So just a little aside story, because computers in this day and age will all talk to each other. Okay. This is the Low Income Home Energy Assistance Program, short LIHEAP. And AgeOptions does not administer this program. It's administered by CEDA. So it helps with winter energy services and may also offer furnace assistance, repair or replace. The summer cooling has not been in effect for a while, and the guidelines are for one person, 1,561, and 2,114 for two persons. So to find a site in Cook County, you can just go to ceda.org.net or call the LIHEAP hotline at 877-411-9276. Okay, so that's good, and it's, people will be turning on their furnaces pretty soon, and it's getting chilly. Okay, I want to give you a couple helpful resources. Let me just look at my time, see how we're doing just fine. Okay, the first is called Benefits Checkup, and this is really interesting. It was created by the National Council on Aging, which is a national group, a standing national group, and has a national database. So for people 55 years and older, it screens you for 2,000 different benefit programs, and it's online, benefitscheckup.org, www.benefitscheckup.org. Okay, and then the other one, for those people who are receiving Medicare or will be receiving Medicare, it's medicare.gov. And that the GOV designates that it's a specific government organization. So on this site, you can sign up and change plans. You can find helpful forms. You can get resources. You can get help, file claims and appeals, and find out what Medicare does and doesn't cover. And just so we all know that there's something called the open enrollment period, and that will be coming up on beginning October 15th, going to December 7th. So that's an opportunity for people to see if perhaps they want to get a different drug plan, a Part D for drugs, because sometimes your drugs have changed or the plans have changed, etc. So that's something to be aware of. And the site has become much more consumer friendly, and a chat box, etc. So that's information for you to know. Okay, another helpful resource is called the ElderCare Locator. That's a public service of the U.S. Administration on Aging and connects older adults and families to services. So it's throughout the nation. So you would call or go online, eldercare.gov, again, gov, part of the government, 1-800-677-1116, 1116. So let's say you have a relative or neighbor that lives in Portland, Oregon. I'm just throwing that out. And you want to know what is the agency that can help that person. So you would go online or call them, and they would tell you the area agency on aging, the AAA, not the American Automobile Association, like we are for suburban Cook County, that could help that person. So it's a good resource. They also have information on information and assistance providers, AAAs, aging and disability resource centers, state agencies on aging, SHIP. Again, we live in a world of alphabets. SHIP is the Senior Health Insurance Program, long-term care ombudsman, legal services, elder abuse prevention. So that's a really good resource for people that live outside of suburban Cook County and throughout the country. Now, at the beginning, I talked about that we serve individuals with disabilities as well as older adults 60 and above. And that's for older adults, the age is different for so many programs. Medicare at 65, full Social Security at 66. For AARP, it's much lower. And for us, 60 is the number. But for folks that have disabilities, there are several really good resources. And the first is called the Progress Center for Independent Living. And that's, you can see the phone number there. It's people under the age of 60 that reside in suburban Cook County. There are 2 offices. One is in Forest Park, the other in Blue Island. And for people who live in the city of Chicago, Access Living. And then there's also something called the Illinois Network of Centers for Independent Living. And you can go online and find out where they are. Okay, so countywide information and assistance. So again, we are AgeOptions. We cover suburban Cook County. Our number, so write this down, is 708-383-0258. 708-383-0258. Okay, and you can always call us. We have information and assistance. So we have people that are staffing the phones, and I do that part-time as well. That's part of my job. So if people call about questions about housing, and we're not housing locators, but we do have lists of senior buildings, affordable housing, other kinds of resources, transportation, etc. And then we can also refer you to the agency, and we did that alphabet soup before, the Aging and Disability Resource Center or network, and that a specific organization will cover a specific geographical area, and they will also help people apply for benefits, and they also do more case management. And then if someone needs help at home, they will do an evaluation. They're the ones that provide the home delivered meals, etc. So you can always call us and ask for information and assistance and say where you live, and we will tell you what organization covers your area. Now, if you're in the city of Chicago, that is another agency, and that's Chicago Department of Family and Support Services, Senior Services. And that's the 312-744-4016. Again, 312-744-4016. And then the color counties outside of Cook County. So color counties, we're talking about Lake County, Will County, Kane County, Kendall County, and there are many. And the organization that is in charge of that is called Age Guide. And they have an 800 number, 1-800-528-2000. And then you say which county you're in, and then they would put it to the right organization. So lots of information here. So I want to say thank you. It was really great talking to you all. And I think there's like 16 people on this call, and then probably lots more on Facebook Live. For information and for a benefits screening, you can contact our benefits department. It's much better to go to the benefits department because we're a team of people. I'm doing a lot of different projects. So if you ask for me specifically and I'm out doing presentations or doing other things, it'll be more delayed. So your two ways of getting a hold of us are benefits@ageoptions.org, benefits@ageoptions.org, or our main number, 708-383-0258. And you can just say, benefits, please, or extension 393. But you can just say benefits and they will take you right to our department. And also there's an 800 number that's at the bottom of the screen, and that's 1-800-699-9043. 1-800-699-9043. For those people, if you have limited minutes, etc. So I would say, I think we're going to stop the recording now so that if people ask questions that are somewhat specific, that it doesn't go out, stay out in the Ethernet forever. And so I think we're going to stop that and then open it up. So just happy to hear what y'all think.
Well, Joy, I'm popping back on. Thank you for all that useful information. And first tip I learned is I need to slow down because I had my extra coffee this morning. So we do have several questions.
Okay.
And I'm not sure if you addressed this specifically, but Dan would like to know about McHenry County. Is there an equivalent person like you in McHenry County? I guess more importantly, what's the organization we should refer him to?
So I believe McHenry is northwest. I think that's
yes, it is.
Okay, I believe it's one of the collar counties, and that would go to Age Guide. So let me just give you, hold on just a second, whoever asked that. And that would be, Age Guide is 1-800-528-2000. 1-800-528-2000. And then the other thing you can always do, like this wasn't asked, but the ElderCare Locator, that's for the whole country. So let me just give you that number, like in case someone else has someone that's in Southern Illinois, for example, right? So that's 1-800-677-1116, 1-800-677-1116, or eldercare.gov is the website.
Well, and that ties into the second question, which how does ElderWorks tie in with eldercare.gov and also with Joy? So I'll start answering part of that, and just let everybody know that ElderWorks, is also a nonprofit. And like so many of us, there's a bit of overlap, and you can go to more than one resource. So the clue about eldercare.gov is it ends in GOV. So it's a government federal program, whereas here at ElderWorks, we focus on person-centered referrals. We're a team of 9 of us that cover the entire state of Illinois. And besides providing guidance on housing, we also provide many, many other referrals like elder law attorneys, realtors. What we find is once an older adult starts to consider moving or a health incident occurs, there's many questions that get answered and asked. So I don't know, Joy, do you have something else to add with that?
In terms of AgeOptions?
Yeah, well, how do all 3 of us are resources, I think is kind of the summary.
I think so too. So basically, I would just say for us, when I'm on information and assistance, sometimes the callers say, I got your number from ElderCare because we're the area agency on aging. So yes, we all work together, isn't it? And that's a good thing.
Yes, it is. And especially in this time of pandemic, what we've seen is our nonprofit resources have been really strained.
Mm-hmm.
And, the fact that many people that have never had a need for food are having to go out there. So more than ever, us nonprofits need to stick together and do the best we can to help each other.
Absolutely.
And the next question says, I already received my license plate sticker in August. Do I have to wait until next year to apply for discount, BAA, or would they issue a refund for the difference if I applied now?
Yeah, so my understanding from the question is that the person paid the full amount, and it appears they think that they're eligible in terms of the income. So my suggestion is to call us, or I don't know where, just call us, call us, but call us and ask for 393. Say that you were on the ElderWorks call, because we always like to know where people are getting the referrals from. Or if you have the computer, you can do benefits@AgeOptions.org, and there is a refund. That is my understanding. Yeah, no, you wouldn't have to wait 2 years.
Okay.
You could use the money before then, right?
Obviously. Someone else wants to know if we can get your slides.
Oh, absolutely.
Okay. So if you want to just message me in the chat box and with your email, I can get that to you.
Okay.
And
I don't know if there's any way to, oh, okay. I'm also, Carolyn, I'm also reading the questions here. So.
Right. So we can handle that. Okay. And
okay.
So next, a relative of mine with disability has a condo in his daughter's name. They are eligible for services, but they are not availing services because they were told that the government will take over the house in which the couple lives. He is eligible and has several health issues and needs the services. This might be what we have to take offline.
This seems like a really complicated question, and it might need, in my opinion, and Carolyn, you please weigh in on this. I would think you might want to get some legal assistance in terms of how to navigate, because sometimes things are specific to people. We're not sure what kind of how the condo's being held, if there's liens. So I wouldn't even attempt. We are never given any kind of legal assistance, and we always refer to nonprofit legal agencies. So you could weigh in on that one too, Carolyn.
No, I completely agree. I always say, we at ElderWorks know a little bit about a lot of things, but we'll find you an expert. And what we've done over the last few years is we've really extended our network of resources that are willing to work with our social service clients. So I personally can help you with that. Either way, definitely it's worth pursuing offline.
Yeah, absolutely.
Okay. So we got another request for the presentation from Basim, and I see that there's we have your contact info, so that's basically taken care of. And Lisa would like to know, did you give the extra health income asset guidelines? And are the guidelines you gave in the presentation for 2020 as well as 2021? Oh, good question.
You people are asking really good questions today. So it's better to kind of call us for that specifics. Let me just tell you, I have a colleague and she spends hours and hours looking at different programs at specific times of the year and updating the income asset. So since we're not into 2021, I can tell you, no, that's anything that I'm telling you is not for 2021. And that, so if somebody's thinking of applying for something next year, which is coming up soon, right? It's amazing. We're in October, so it's only 3 months. Definitely check in on that because things sometimes change. They go up in terms of the benefits, sometimes in terms of what people will be getting, sometimes the requirements, you know, in terms of your income or your assets go up a little bit too. But so the answer is no, not yet.
Okay, so when is there a certain time of year when you get that information?
Here's the challenge, because some of this is updated, and she is the expert, my colleague Elizabeth. Some is in the fall, and some is in March, often in March, sometimes in July. So it depends on the benefit.
Got it.
Yeah, unfortunately, that's kind of the way it is.
Okay, and so I've had multiple requests for the slides, and all I can say, I know it was really good information, is really good information, is as long as you put your information in the chat box, we'll take care of you. I do have some people that don't have a name, they are attendees, and so I just need to, you'll have to identify yourself in the chat box, and we'll be happy to get the slides to you. And then it says, I've had severe decline in my 2019 income that would allow me to qualify for some of these programs, but I expect my income for 2020 or 2021 to be above those levels. Am I still eligible to apply for some programs this year? Hey, that's a great question, because I'm sure many of us are dealing with fluctuating income, and maybe a spouse is not working, etc. So Joy, what do you have to say about that?
You people are asking excellent questions today. First of all, I would say none of us know what 2021 is going to bring, and we all hope that it will bring better things to each one of us and each one of you. So I wouldn't, look at that. I would say, if I understood your question correctly, let's see, let me see if I can look at it here, Q&A. All right, so, it's, all right, I think you read it already, so it's gone here. Okay. So
I'm sorry.
Okay, no
Here,
worries.
I can go back to answered, okay.
Yeah, I think it was in 2019.
Yeah, the 2019 was when the income declined. And so now they're expecting 2020 and 2021 to be a little bit above those levels. So okay. I think we're looking for benefits where they look at your 2019 income.
Yeah, so then definitely, I would say, here's the story. If you don't try, you don't know. So I would say definitely call us, and because it depends on the benefit, or it depends on how much over. There's so many variables that it's always good to try. And, sometimes our department does a screening. It's certainly not as comprehensive as the benefits checkup, but we'll get information from you, and then we kind of look, okay, well, maybe this, maybe that. okay, let's try the license plate discount. Okay, let's hear about this. Are there a lot of other bills? There's a lot of variables. So my suggestion is just to call us or email us, and then we'll see. We'll be happy. And just, I'm going to ask you, if you do that, if you can just mention that you got the contact information from the ElderWorks presentation. That would be great, because we're trying to figure out how we can reach more people. And so that's great information.
Well, and Joy, I mean, along those lines, we, ElderWorks, our greatest challenge is people don't find us until there's a health incident is usually the norm, or we get a lot of calls right after the holidays when adult children visit parents and they see that things aren't exactly the way they thought they were. And so as nonprofits trying to help as many people as we can, you know, the one thing that you can do for all of us is let your friends and family know. We're doing this free virtual education. Many older adults are learning how to embrace Zoom because their grandchildren and people that were born with a keyboard are helping out.
Love it.
And so, and worst case, if you don't have a tablet, laptop, or etc., you can still listen in.
Yeah, and I would like to also say that, and it's a great point, Carolyn, for us, for AgeOptions, you know, I think there's 15 or 16 people on the call. So for some of you, you know, you might be eligible for some of these benefits, but you also have relatives, neighbors, friends. And I think especially since you've heard this and you know that we really do want to help people, and there is kind of sometimes a little embarrassment, a little shame of asking for help, and there shouldn't be. You know, people have worked hard all their lives. Situations are out of our control sometimes. So please share our phone number and our email, and then just say you got it from a presentation from ElderWorks. You know,
Right.
we'd be most happy for you to do that.
And if anyone else, you know, like I said, ElderWorks office is open. We are doing all our training virtually. However, if you need support, please call our office. Emily is there waiting to answer the phones. And we will help get you to the right resource, because we sincerely do want to help. And we know that there's more people than ever that need assistance. So please spread the good word.